In this next section, we'll be looking at the names and pathways of the principal arteries and veins. We'll begin with the pulmonary circuit and then look at the systemic vessels of the axial region, as well as the vessels of the appendicular region. The pulmonary circuit begins with the pulmonary trunk. The pulmonary trunk is a large vessel that ascends diagonally from the right ventricle and branches into the left and right pulmonary arteries. Here we see the pulmonary trunk branching into the left and right pulmonary arteries. Remember, the pulmonary arteries carry deoxygenated blood from the heart to the lungs. This artery then forks into the superior lobar artery, the middle lobar artery, and the inferior lobar artery. Each of these supplies the lobes of the lung. The left pulmonary artery seems to be much more variable than the right pulmonary artery. Then bringing blood back to the heart, we'll see pulmonary veins. Now they're carrying oxygenated blood, and they return it to the left atrium. Now naturally, there are many more divisions here, but that's all we'll be holding you responsible for. Each of these arteries will span out into a basket-like capillary bed that surrounds each of the alveoli. The alveoli are the air sacs in the lungs, where gases actually exchange with the blood. Now we'll look at the systemic circuit. This supplies oxygen and nutrients to all the organs and removes their metabolic waste. We've already covered the coronary circulation. So in this section, we'll take care of the rest of the arteries and veins of the axial region. This includes the head, neck, and trunk. So as we tour through the different systemic arteries here, maybe you'd like to have anatomy and physiology revealed open and look at some of them in the actual cadaver setting. There's a great deal of anatomical variation in the circulatory system from one person to another. So often we'll find our way around by sort of counting exits along the arteries. Mostly the names of the blood vessels describe their locations and indicate the region of the body that's being traversed, the adjacent bone, or the organ that it supplies or drains. In most cases, the artery and adjacent vein have similar names, for example, the femoral artery and the femoral vein. In general, artery, singular, is abbreviated A, little a, and arteries are abbreviated AA. And then vein, singular, is noted as V, whereas veins, plural, are noted as VV. This is a common convention. So let's look at the major branches of the aorta. First of all, we have the ascending aorta. This is the part that goes up. It has little tiny branches off of it, the right and left coronary arteries that supply the heart. However, over the aortic arch, there are three main exits. The first of which is the brachiocephalic trunk. The brachiocephalic trunk will split into the right subclavian artery and the right common carotid artery. As we continue over the aortic arch, the next exit we'll see is the left common carotid artery. And the third exit is the left subclavian artery. The subclavian arteries will go out to supply the arms. We'll take a further look at them later. But these are the first major exits off of the aorta as it leaves the heart. The aorta then wraps down around behind the heart and descends through the diaphragm in the abdominal wall. The common carotid artery will divide into the internal and external carotid arteries. You can see this pictured here. The external carotid artery goes up and outside the skull. The internal carotid artery will go up and enter the skull. Now, when we look at the arterial supply of the brain, it's very complicated. We're not going to go into too much details here. Basically, we'll understand this circle of Willis. This is at the base of the brain, and it's formed by anastomoses of both the basilar and internal carotid arteries. And it's involved in supplying the brain, the internal ear, and all the orbital structures, that is, of the eye. So, of all these vessels that are on the brain, these are the only ones we really need to know. So there are a couple of different layers of veins. The deep ones are going to run generally parallel to the arteries. However, superficial ones have many anastomoses. You can see in this figure that different veins are shown on the left side than are on the right. Keep in mind that all these veins will be found on both sides of the body. Let's look into the veins of the head and neck. Around the base of the brain, there are large, thin-walled dural sinuses. These are large spaces in the veins for storage of blood as it waits to return to the heart. These form in between the layers of dura mater. Blood is drained from the vein by the internal jugular vein. So the common carotid artery will take blood up towards the head, and the jugular vein will return blood towards the heart. The jugular vein, as with the carotid, is divided into the external jugular vein and the internal jugular vein. The external jugular vein is bringing blood back from the outside regions of the head, whereas the internal jugular vein is bringing blood back from the base of the brain. It'll bring blood back into the subclavian vein on both sides of the head. Now let's step down into the thorax. The thoracic aorta is the portion of the aorta that is in the chest cavity. It supplies the viscera and the body wall. We'll see that there are a bronchial, an esophageal, and mediastinal branch of the thoracic aorta. Don't worry too much about those branches. Also note that there is a posterior intercostal artery that supplies the back ribs, and phrenic arteries. Again, don't worry too much about identifying these in Anatomy and Physiology Revealed, but be aware that they're there. Now we move down into the abdominal aorta. So we move from the thoracic aorta in the chest to the abdominal aorta down in the abdominal cavity. As it plunges through the diaphragm into the abdomen, the aorta will give rise to the celiac trunk. This supplies most of the digestive organs and has 3 branches of its own. Next, we reach the superior mesenteric artery. The superior mesenteric artery will supply the intestines. Next, we'll see the renal arteries. The next important arteries we'll see are the gonadal arteries. They either lead to the testes or the ovaries. Next, we come down to the inferior mesenteric artery here. The inferior mesenteric artery will supply the distal end of the large intestine. The aorta will then split into the common iliac arteries. These are on their way down into the legs. Now let's take a closer look at some of these branches. We'll begin with the celiac trunk branches. The celiac trunk will supply the upper abdominal viscera, such as the stomach, spleen, liver, and pancreas. The 3 vessels that come off of the celiac trunk are the splenic artery, goes to the spleen, the left gastric artery, and the common hepatic artery. Now a closer look at the mesenteric arteries. The superior mesenteric artery here is the most significant intestinal blood supply. It serves nearly all of the small intestine and the proximal half of the large intestine. It gives off a number of different branches. I'm not going to hold you responsible for all of those branches. You can look them up when you need to. The inferior mesenteric artery comes from lower down on the abdominal aorta and serves the distal part of the large intestine. It also has several different arteries that you should note, but you don't have to memorize them all. So now that we've covered all the descending aorta exits, let's take a look at the inferior vena cava. That is the vena cava that's returning blood from the lower portion of the body. Coming back from the legs, we have the common iliac veins. They correspond to the common iliac arteries. Here we have the inferior vena cava. You'll notice here that we'll have corresponding veins to most of those arteries. We'll have gonadal veins, as well as renal veins. Of course, the renal veins supply the kidneys. We also have suprarenal veins, as we did with suprarenal arteries that go to supply the adrenal glands that sit on top of the kidneys. The only other vein in here that we really need to pay attention to is the hepatic vein. That supplies the liver. We see that fork off up here in a corresponding place to the celiac artery. The hepatic portal system is the system that drains nutrient-rich blood from the stomach, spleen, and intestines and takes it to the liver so that blood sugar levels can be maintained. Remember, a portal system is where we have two capillary beds joined together by a vein. So in this case, there's going to be a capillary bed surrounding the stomach that leads to a vein, and then that vein opens up into another capillary bed throughout the liver. All right, so that wasn't so tough. We've now covered all the systemic vessels of the axial region that you'll be held responsible for. Be sure to spend some time right now in Anatomy and Physiology Revealed and view those in situ in the cadaver. And now we'll move on to explore the systemic vessels of the appendicular region. Although the appendicular arteries are usually pretty deep and well protected, the veins are going to occur in two different layers, deep and superficial group. The deeper veins will run parallel to the arteries and often have very similar names. In several instances, the deep veins will occur in pairs that flank the corresponding artery, such as the radial veins traveling alongside the radial artery. The venous pathways have many more anastomoses than arterial pathways, so the route of flow is not often clear. We'll just highlight the major veins. Let's begin in the upper limb. The subclavian artery passes between the clavicle and the first rib and descends into the arm. The vessel is going to change name as it passes into a different region, so it becomes the subclavian artery. So now, rather than the subclavian artery, it's called the axillary artery, which will then become the brachial as it passes the brachium, and the radial and ulnar as it goes into the forearm. The brachial artery is used for blood pressure, and the radial artery we use to measure pulse. So again, the vessels we need to know here are the subclavian artery. There's one on the left and the right side. That will turn into the axillary artery as it moves through the armpit region. And then it will become the brachial artery in the arm. There'll be a deep branch and a superficial branch. As this blood supply moves down into the forearm, we'll start seeing the radial artery and the ulnar artery. These are the only arteries that I needed to know in the upper arm. Now let's look at the veins. We have corresponding veins. We have a subclavian vein. We have an axillary vein. We'll have a brachial vein. And then we'll have paired radial and ulnar veins. That's pretty much it. We're just looking at the deep layers of veins here, although there are many more veins in the superficial regions, which by all means you should familiarize yourself with. Those are the main veins that I will hold you responsible for. Now let's look at the lower limbs. The branches in the lower limbs will arise from the external iliac branch of the common iliac artery. The external iliac branch passes right through here. You can see here the femoral artery as the vessel descends down into the upper leg. Then we'll see the vessels go down into the lower leg where you'll see the anterior tibial artery as well as the fibular artery, named for the corresponding bones. You'll recall those from last semester. Other than that, I don't need you to keep track of many more arteries in the lower limb. Let's look at the veins. There's both superficial and deep. We'll stick mainly with the deep ones. We've got deep femoral veins. Also on the surface, we have a superficial femoral vein or regular femoral vein. The other vein we need to keep track of in here is the great saphenous vein. In the lower limb, again, we'll see that there's an anterior tibial vein as well as a fibular vein. And then the small saphenous vein would be a good one to keep track of. So look at that. Now we've covered all the major vessels. The ones we've covered in this section of the lecture are the ones that I'm going to hold you responsible for. Be sure to find them all in Anatomy and Physiology Revealed. Let's look at some pressure points. Some of the major arteries are very close to the surface, which allows for palpation of pulse, and it serves as pressure points to reduce arterial bleeding. These are some of the highlighted points. The radial artery is the one that we measure in the wrist. You're probably familiar with that. If we can't get that, the brachial artery is another good spot. You've probably also measured at the common carotid artery. You can certainly feel your temporal pulse and sometimes the facial pulse. The femoral pressure point is highlighted here. You can see the femoral vein clearly comes close to the surface, and right in the groin we can palpate and get a great pulse. There's also a pulse right behind the knee on the popliteal artery. Perhaps we need to add popliteal artery to our list. And then we can also measure them on the dorsal pedal artery or the posterior tibial artery in the foot. So that's it. That brings us to the end of this chapter. Be sure to spend plenty of time out there looking at Anatomy and Physiology Revealed. And don't forget that you can have it quiz you. That's a really great function.